Hi, Dr. Jeff Sternberg from the Sternberg Clinic in San Francisco again. So, why have I decided to specialize in pilonidal care? I was complicit in a lot of terrible operations when I was in one of the Harvard training programs in Boston during my general surgery residency. I worked with amazing professors who did amazing surgery, but when it came to pilonidal disease, they did old-fashioned, outmoded, horrible operations that I had to become complicit with because I was in training and I didn't have a say in what was done. So I helped them excise large amounts of tissue as if it were a cancer operation, but it was only an operation on an infection in young people's buttock cracks. Then I would see these patients back in clinic every week, and after 2 months of being on a single surgeon service, many of these wounds were unchanged and unhealed. I said to myself, I am never going to do that operation ever, and I never have after I finished training. So I met a great mentor in my fellowship training at the University of Minnesota in colorectal surgery, who told me to speak to John Bascom, a surgeon in Eugene, Oregon, who had come up with a better way to treat pilonidal disease. He called it the cleft lift procedure. I learned it from him, and I've changed it a bit, and now I like to call it the pilonidal RAF for rotation and advancement flap procedure. I think this is the only way to go for this poorly understood and underappreciated condition, which so profoundly affects patients and their families. We hope to see you in San Francisco.